Hello and welcome. You are about to begin the Certified Behavioral Health Case Manager and Supervisor training. This training is required for all applicants seeking the Certified Behavioral Health Case Manager Supervisor designation, the Certified Behavioral Health Case Manager designation, and the Certified Behavioral Health Case Manager Provisional Status credentials. The credentials are for people who provide or supervise those who provide direct behavioral health case management services to adults or children with serious mental health conditions, substance use disorders, and or those who are involved in the child welfare system and require behavioral health case management services. Credentialed individuals are qualified to provide case management services according to the Florida statutes, which identifies those direct services provided to a client in order to assess his or her needs, plan and arrange services, coordinate service providers, link the service system to a client, monitor service delivery, and evaluate patient outcomes to ensure the client is receiving appropriate services. The Certified Behavioral Health Case Manager and the Certified Behavioral Health Case Manager Supervisor credential meets the certification requirements of the Florida statutes. This training curriculum has been devised by the management team at Salus Care in Fort Myers. Salus Care is a behavioral health case management approved employer. The agency has over 400 full-time employees and is accredited by CARF, the Commission on Accreditation of Rehabilitation Facilities. Major contributors to this curriculum include Deborah Patterson, licensed mental health counselor and Vice President of Quality Management, and Barry Wyrick, MBA and Salus Care Quality Management Manager. Additional contributors include Idris Jameson, Director of Community Care Coordination. Information was also provided by Stephanie Brooks, Children's Case Management Manager. The curriculum training is made up of 5 performance domains. This is Domain 1, Engagement and Assessment. In this domain, you can expect to develop competencies in 5 areas. 1. Facilitate the client's understanding of the rationale, purpose, and procedures associated with case management services. 2. Obtain relevant information from the client and meaningful collateral resources in order to assess the client's current situation and identify any immediate needs, including but not limited to the safety and well-being of the client in his or her natural environment. We will also talk about the 3rd competency, administering the appropriate assessment instruments to gather information and initiate a process of shared decision-making and goal setting focused on the client's strengths, needs, abilities, and preferences. In the 4th competency, we will learn how to analyze and synthesize assessment data in order to identify problems and opportunities that would benefit from case management intervention. And the 5th competency in Domain 1 is learning how to conduct ongoing assessment through the life of the case to identify emerging needs and maintain case relevance. In going through these slides, the person the case manager will be working with is often referred to as the client. It could also be referred to as the patient, the person served, or the individual. The definition of case management is a collaborative process that assesses, plans, implements, coordinates, monitors, and evaluates the options and services required to meet the client's mental health and substance abuse needs, otherwise called behavioral health needs. Case management is characterized by advocacy, communication, and resource management, and promotes quality and cost-effective interventions and outcomes. Case management principles and core functions. The purpose of case management is to assist the client in gaining access to needed medical, mental health, substance abuse, social, educational, and other services. The primary goal is to optimize the functioning of the client by coordinating the provision of the quality treatment and support services in the most efficient and effective manner. Services should accurately reflect the individual's needs, goals, and the abilities of each client. Case management population groups include children from birth to 17 years old, adults 18 and older, and all clients must meet the eligibility criteria for case management services. Case management presumes active client involvement as a partner with the case manager in planning and implementing services. The direction of intervention is always based on client choice and the client's control his or her own destiny. That's self-determination and that's self-advocacy. The case management intervention assumes the responsibility for integration of significant others, family, friends, if the client consents, and those family, friends, collaterals contribute to the planning, the execution, and the achievement of goals that the client has determined in that negotiation process with the case manager for the service plan. The case manager reduces involvement in accordance with the client's ability to plan for his or her own needs and yet remains sensitive to fluctuations in that ability. Case management is an area of specialty practice within the health and human services profession. Its underlying premise is that everyone can benefit when clients reach their optimum level of wellness, self-management, and functional capability, including the clients being served, their support systems, and the healthcare delivery systems and the various payer sources. Case management facilitates the achievement of client wellness and autonomy through advocacy, assessment, planning, communication, education, resource management, and service facilitation. Based on the needs and the values of the client, and in collaboration with all other service providers, the case manager links clients with appropriate providers and resources throughout the continuum of health and human services and care settings, while ensuring that the care provided is safe, effective, client-centered, timely, efficient, and equitable. This approach achieves optimum value and desirable outcomes for all. Case management services are optimized best if offered in a climate that allows direct communication among the case manager, the client, the payer, the primary care provider, and other service delivery professionals. The case manager is able to enhance these services by maintaining the client's privacy, confidentiality, health, and safety through advocacy and adherence to ethical, legal, accreditation, certification, and regulatory standards or guidelines. Case managers are certified. Certification determines that the case manager possesses the education, skills, knowledge, and experience required to render appropriate services delivered according to sound principles of practice. Now let's look at what the case manager does and doesn't do. The role of the case manager is to assist the client in achieving their goals. The case manager engages the individual, makes an assessment of their situation and their request for services, helps develop a plan and identifies goals with the individual, sets up interventions to help the individual achieve those goals, monitors and coordinates those services, and then enters into a termination phase with the individual. During the assessment phase, the case manager analyzes information provided by the client concerning the client's strengths, needs, abilities, and preferences. We talked about those in terms of SNAP. S is for strength, N is for needs, A is for abilities, and P is for preferences. The case manager also takes into consideration the client's environment, family, significant others, and barriers to services. The case manager will recommend to the client services and an initial plan for care. During the assessment, a home visit will be included where the case manager can observe how the patient lives in the environment, and when the patient signs release of information forms for each individual, the case manager can meet with family and significant others to obtain collateral information on the client's behalf. Moving on to service planning. The goal of service planning is to help the client function as independently as possible. Service planning is a negotiated process with the client. The case manager offers suggestions for care based on the assessment and the client's initial request for services, and the patient identifies their preference. The plan for care is fine-tuned with the client input, and when the client is satisfied with the plan, the client signs the plan along with the case manager, and the client is provided a copy of the plan. Plans are written in a manner in which the client can comprehend. Therefore, language is important. With children, pictures might be incorporated into the plan, and the child and family might put that plan up on their refrigerator to keep track of their progress. The service plan identifies goals the client chooses and the steps or objectives to take to accomplish those goals. Services and treatment agencies and individuals are identified in the plan, along with an estimate of how long it will take to accomplish each step and the overall long-term goal. The individual is given information about how the plan can be changed, and the plan is reviewed at each meeting. The plan is updated whenever a significant change occurs, or at least every 6 months. Coordination of services. The case manager arranges for and sets the conditions for service delivery. This means the case manager reviews the options for services with the client, and when the client identifies preferences, the case manager sets up appointments with providers that are convenient to the client. Sometimes the case manager will coordinate services with other agencies and professionals, landlords, food banks, shelters, etc. The case manager is an advocate and links the client to services. The case manager represents the client and is an advocate for the client and helps the client speak for themselves. The case manager works closely with the client, especially at first when the client needs more support, and the case manager makes sure appointments are kept, clients' needs are being met, and the services continue to be appropriate for the client's needs. The client lets the case manager know how the plan is progressing, obstacles that might be encountered, preferences, and needs that have developed since the plan was first initiated. This leads into the role of the case manager to monitor services. Case managers do not make judgments about the providers working with the patient. This can be a slippery slope for some case managers. Case managers should not be making judgments about the specific treatment. If a client has complaints about a part of the service plan, the case manager can support the client to discuss concerns with the treatment provider. Case managers should refrain from making disparaging remarks about treatment providers. The monitoring actually means keeping track of what goes well and what does not go well. The case manager analyzes the effectiveness of the service plan for the client. The case manager documents what happens during the course of case service coordination. In the course of case service coordination, the case manager will work with families and significant others and natural support systems once the client has identified and provided release of information for the same. Review and periodical update. The review includes progress made towards the goals and objectives. New objectives or goals might be established, and the review occurs in a conversation with the client. Negotiation for revised plans may occur. Termination of the case management relationship is discussed and timed out so the client can anticipate the end of the relationship. Again, the stages of case management include engagement, assessment, planning or goal setting, intervention, monitoring and coordinating, and termination. So let's review the case management functions. The case manager assists the client in gaining access to needed medical, social, educational, and other services. The case manager conducts an assessment surveying the client's strengths, needs, abilities, and preferences. A plan is devised with the client, and both the case manager and the client continue to assess the effectiveness of this plan in meeting the needs of the client. The case manager does not provide hands-on direct clinical services. Rather, the case manager links and facilitates the client to appropriate services and resources identified in the plan, and makes referrals for those services and treatment. The case manager advocates for the client. The case manager coordinates the delivery of services with the help of the client, the family, and the natural support system. And all through all of this, the case manager documents the process. Complete the test for this section and then move on to the next section.